A Premium Plus checkup program was organized for one of our viewers who is called Dzintra. She consulted a physician on the first day of the program. Today we are planning to discuss your complaints about your health and the problems which you have right now. Then we will talk about the questionnaire which you filled out and sent to us. We have read it and identified a few questions. Afterward, of course, we will discuss the things which you would like to know about the program. Then I will examine you, measure your blood pressure, check all of your organ systems, and discuss our plan for all of the expected medical examinations. After checking the completed questionnaire, the physician conducts a visual screening of the patient's organs, her height, and her blood pressure. Considering your age and these findings, we would suggest the use of a slightly personalized premium program because you have complaints about your spine. On the second day, Dzintra underwent the examinations that were recommended by the physician. The schedule was very tight, but everything went well because the program was well planned out. First, she underwent blood, urine, and stool tests to demonstrate the general state of her health. After this, she underwent lung X-rays. The results of the examination were digital, and they were automatically forwarded to the physician. Next, Dzintra underwent an electrocardiogram. This method of examination is most often performed on patients who have chest pains, suspected heart rhythm disorders, elevated blood pressure, or heart insufficiency. Echocardiographs examine the heart with the use of ultrasound. Anyone who has ever had complaints or suspected that there might be something wrong with his or her heart should undergo an echocardiography once in a lifetime. Echocardiography as a diagnostic technique has developed very rapidly, and highly developed technologies are now available so as to considerably facilitate the diagnosis of heart pathologies with the help of ultrasound. These latest generation devices allow us to determine heart muscle rotation and tissue rate, looking not just at the flow rate, but also at the rate of the cardiac muscles. Dzintra also underwent veloergometry, which is a load test that demonstrates the capacity of her heart in terms of withstanding physical effort. During the examination, the patient achieves a certain load by pushing the pedals of an exercise bike. An electrocardiogram is recorded, blood pressure is measured, and heart rhythm frequencies are determined. Because Dzintra also wears glasses, the physician prescribed an eye examination. We first measured ocular tension with a non-contact method. This takes a few seconds and does not make the patient wait. Then we measure the sharpness of vision and check it through a microscope. These devices allow us to examine everything at an early stage. One of the patient's complaints was that she was feeling tiredness in her legs. For that reason, she also underwent duplex ultrasound of the veins in her legs. When a patient comes for an initial diagnosis and we check the state of her leg veins, we can determine whether she should come in once a year or whether we suspect the onset of a pathology. If the veins are completely healthy and there are no complaints, then the person can come in once every 2 years. If we identify a severe pathology, then we can prescribe the relevant treatment method. This can involve initial compression therapy, drugs, physical procedures, and so on, or it can require an immediate operation. First of all, we conduct a visual examination of the legs to see whether the vein nodules are enlarged in any location or if there are varicose veins. There may also be changes in color or skin lesions. After the visual examination, we perform thorough vein diagnostics with the use of a sonograph. We check the deep veins, how much they were filled, what the flow of blood was, and what the pulsation was. We would not have been able to perform such precise diagnostics with a sonograph of an older generation. Here we can see a pulse wave, which can only be evaluated with the use of premium class devices. The pulsation is absolutely normal, and the arterial blood flow reached the patient's foot. Very good. It is important to check not only the veins and blood vessels of the legs, but also the vascular system of the head and neck. This is done with the help of ultrasound. This is a high-quality and modern ultrasound examination method which allows us to examine the structure of the blood vessel walls assess blood circulation in the brain, and ascertain whether everything is fine or if there are certain issues. This is especially important for patients with high blood pressure, an increased cholesterol level, diabetes, or other diseases such as heart diseases and others. If there have been strokes or circulatory failures in the patient's family, then the procedure is absolutely necessary. After the age of 50, women should visit a gynecologist once a year to undergo all necessary examinations, including cytological analysis and an ultrasound examination of the small pelvis. A modern gynecological examination is hardly possible without an ultrasound examination of the small pelvis. The examination is very important as it allows us to diagnose various neoplasms very quickly, also looking at various changes in the pelvic organs which the woman does not feel and which the doctor cannot find during a regular examination. A high-quality and latest generation device offers a high level of resolution with 3D and 4D sonography. It is extremely important because it allows us to examine the pelvic organs as well as the fetus during pregnancy in a more detailed and thorough way. Our latest generation Voluson 8 device is the latest device with the highest resolution level. It is available for gynecologists during examinations of pregnant women. We use it to examine gynecological patients and pregnant women. Women after the age of 50 must also undergo breast mammography. Dzintra had an opportunity to undergo mammography examination with the latest generation device that involves tomosynthesis. The greatest advantage is that it ensures the reconstruction of each millimeter of the breast, thus helping to disclose possible pathologies at the earliest stages of the process. Ultrasound examination of the thyroid was also performed at the physician's recommendation. We can find out very significant things during this examination. We can look to see whether there is any congenital pathology of the thyroid gland, and we can evaluate its location, shape, dimensions, and structure. We can identify various structures in the thyroid which are sometimes difficult to differentiate if we use simpler devices. For instance, we can identify nodules and determine whether they are good or bad. This device also allows us to distinguish very small but important structures which are not visible with the use of devices from other generations. Because the patient complained about backache, she also underwent an abdominal ultrasound. We needed to see whether the problem related to her liver, gallbladder, pancreas, or kidneys. When general practitioners or other specialists find changes in their findings from any clinical analysis, we first check for possible pathologies, but women at certain stages should also undergo this examination even if there are no complaints. We ruled out the possibility that the backache was caused by the abdominal cavity, and then we performed computer tomography. This is a modern examination method which combines ionization radiation and complex computer technologies. The advantages of latest generation computer tomography include not just a 40% cut in radiation and control over contrasting agents, but also an improved workstation which makes it possible to obtain cross-sectional images of many organs in the form of a 3D reconstruction. On the third day, Dzintra once again visited Dr. Misiņa. In general, Dzintra, your state of health is excellent, and others could only look at you with admiring envy. After a detailed explanation of the findings of the analyses, Dzintra received a final assessment of her health. If we are talking about other general health-related issues, then we have already discussed your cholesterol diet and movements due to cholesterol and vitamin D intake. As to a further regime of examinations, they will be required once a year, including thyroid ultrasound, abdominal ultrasound, gynecological examination, and an eye exam. This is required once a year along with consultations from your general practitioner. Dzintra, you can keep the originals of the examination results and the relevant documents so that you have something which you can consult. Should you require further consultations, you can show those documents to other specialists. All examination data are stored in the medical facility's IT system, and that allows physicians to observe the progress of the findings. On the third day of the examination program, Dzintra shared her opinions and her experience with us. Everything was just great. I am very grateful to all of the doctors and everyone who worked with me and made advances. When I learned the results, I was pleasantly surprised, and yes, everything is fine.